All right, well, hello everyone. So we're going to take a look here at a section of the heart. So what you see here on the screen is a section of our heart wall, right? So just for reference, this let me come back here. This region here, this is our endocardium. What we see highlighted here in blue, this is our endocardium. This is the innermost compartment of the heart, right? The inner lining of the heart. So when blood is in the heart, what the blood is in contact with is the endocardium. If we go one layer more superficial, right now we have our myocardium. Okay, so this is our myocardium. Myocardium being our middle layer, but also being our thickest layer as well. So our middle thick layer, this is the muscle of the heart. So when you think about the cardiac muscle, right? So when you talk about types of muscle tissue, skeletal, smooth, and cardiac, this myocardium, this is the contractile part of the heart. And then we have this external layer, which is actually made up of a couple of different things, right? So I'm actually going to start on the most superficial region, right out here, what we have highlighted in blue. This is called our fibrous pericardium. Okay, the fibrous pericardium, that external most layer of heart tissue, right? So what this is it's essentially a sac that is going to enclose our heart, right? It's going to enclose the entirety of the heart itself. So in gross dissection, whenever you go into the chest cavity, you go into the thoracic cavity, you actually don't see the heart itself, you see the heart enclosed in this fibrous pericardium, right, or this pericardial sac. And you can see it completely surrounds this external region of the heart here, right? If we move just deep to that, if I zoom in here, you can see this layer just deep to it. I'll try to click on it and highlight it in blue here. This is our serous layer of parietal pericardium, right? So again, serous layer of parietal pericardium. So what this means is, let me go back here. So what this means is this is a serous lining, and it's just on the deep surface. It's just on the deep side of the fibrous layer, right? So this fibrous pericardium that we highlighted here, this serous layer of parietal pericardium is just on its deep surface, right? Now, as with our other serous membranes, we have a parietal layer. We also have a visceral layer, right? So that term parietal refers to something like wall. And then the visceral layer, if I click here, this is on the actual, on the heart itself. So this is adhered to the surface of the heart, right? So in gross dissection, you cannot take this visceral layer of serous pericardium, you can't take it and just peel it off, right? The fibrous layer, right, that outer fibrous pericardium, you can. This inner visceral layer of serous pericardium, you cannot, right? Now, one thing that you may see this called, you can see how this completely surrounds the heart here, and again, it's on the surface of the heart. Now, this visceral layer of serous pericardium, you may also hear it called the epicardium, right? The epicardium. So that first one, pericardium, peri means around, right? Pericardium means around the heart. This epicardium, epi means on top, right, or above. So this is directly atop and attached to the heart itself, right? Now you may see, and I'm going to zoom in here, you may see that there's a third layer in between this visceral layer that we have highlighted in blue and our parietal layer that we have right there, right? So that's our parietal layer, and then there's our visceral layer, and we have this kind of purple thing right in the middle, right? So if I click on it here, this is what's called our pericardial cavity, right? Pericardial cavity. And so what this is a space that exists between the visceral pericardium, the visceral serous layer, and the parietal serous layer. And in this pericardial cavity, we have a little bit of fluid, right? So if I kind of move up, right, you can see how that space exists in between those two layers, right? And so what this pericardial cavity is it's going to contain a few milliliters of serous fluid, right, or what you may call pericardial fluid. And And that pericardial fluid is doing a couple of things. One, it's kind of acting as its main role is it's acting as a lubricant for the heart as it's contracting, right? So it's reducing friction, essentially, is its function, right? So you can imagine as the heart contracts with every beat, right, with every contraction of the heart is moving those two layers, the visceral layer, right? So the visceral layer that we have here, and then our smaller parietal layer that we have behind it. Those two layers are sliding against each other, and that little bit of fluid in that cavity is helping to reduce the friction and ease that movement and lubricate it as the heart is contracting. And if you think about the heart is constantly doing that, right? The heart is constantly beating, maybe 60 to 100 times each minute. And so you need something to reduce that friction as the two layers slide against each other, right? So again, that's pericardial cavity. So again, highlighted here in blue, pericardial cavity with a little bit of fluid. Now, sometimes you can get other things in that space, in that cavity, that ought not be there, right? So the thing that you may think of most is there could be blood that could develop here due to some type of trauma, some type of injury. You can get something called cardiac tamponade, in which you get this accumulation of fluid and blood in that pericardial cavity. And what that is, the cardiac tamponade, is it's fluid accumulating in that space, and it's putting pressure on the heart, right? And so the heart has a decreased ability to completely relax, right, or undergo diastole. Diastole is the technical term for relaxation, right? And so the heart's ability to fill with blood, which then results in blood being ejected, its ability to fill with blood is dependent on its ability to relax, right? And so if this fluid is now pushing on the, if it's pushing on the heart itself and it's not allowing it to relax, then the heart now has a decreased ability to fill, and thus the amount of blood that's ejected with each contraction in each minute is going to be diminished as well, right? So in this case, drawing the fluid off, pulling the fluid off of the or out of that space is what's required, right? And so this is a procedure that's done in clinical settings to again draw off the fluid, ease the pressure on the heart, and again that allows the heart to fully relax, right? So again, just as a recap, we have our fibrous pericardium here, right? That outer sac, right? You have your visceral layer of serous pericardium here. You have your that's your parietal layer, excuse me. That's your parietal layer of serous pericardium. There's your visceral layer of serous pericardium. In between, you have your pericardial cavity, right, with a little bit of fluid. If we zoom out, you can see the entirety of the myocardium, that thick middle layer that we have. That is the muscle of the heart, right? The cardiac muscle. It's striated. It's involuntarily controlled. And then lastly, you have your endocardium, that inner lining of the heart. And the endocardium is then confluent. It's the same. It's continuous with the inner lining of our great vessels. So think your pulmonary trunk, aorta, things like that. All right. So please reach out if you have any questions, and I will be happy to answer.